Hello, thank you for attending this session on drug and alcohol testing, your most frequently asked questions answered. I'm Liam Feasey. I'm the Client Services Manager and the Acting Quality Manager at Lextox, and I'll be talking you through today's session. So today, I'll go through an introduction to Lextox, so explain who we are. Then I'll talk through some frequently asked questions on the drug testing side first of all, then move on to alcohol testing, and then conclude with a summary, some finishing points, and how to get in touch. If you do have any questions on today's session, you can email me at experts@lextalks.co.uk, and I'll be happy to email you a reply. Okay. So Lex Talks was established in 2011, and our aim then remains the same as it does today, and that is to provide our clients with reliable results and the most responsive client-oriented service. So the analysis results and expert reports that we issue are issued by experts, our own experts, who have a combined experience of over 100 years. So we really do have the knowledge and the expertise to interpret the analysis results and also to attend court to give evidence if we need to. In 2017, Lex Talks became a member of the Synlab Group, which is the leading medical diagnostic services provider in Europe. And today we are trusted by more than 14,000 family law solicitors and local authorities across the UK. Okay, so if we start going through some of the frequently asked questions that have been issued to our experts over the past few years. And then hopefully today's session will give you the answers to those questions and therefore increase your knowledge around the hair testing that we provide. So to begin with then, what's the difference between a month-by-month analysis and an overview analysis? Essentially, a month-by-month analysis segments or sections the hair sample into individual monthly sections. So you would have a result for each approximate 1 month time period for as long as the hair is tested. So this is really useful for establishing a trend in drug use over a period of time. So we'll be able to see if the levels detected are increasing, decreasing, or intermittent within that testing time period. So it's really useful for obtaining a pattern of drug use within that tested time period. An overview analysis is where we just look at 3-month section as a whole. So it's covering the whole 3-month period, which is looking at a 3-centimeter section. So that's why it's called an overview, because it's an overview of the whole, the 3-month. So an overview is really beneficial if you just need to obtain an indication of drug use within a set time period. Whereas the month by month is really useful to obtain more of a pattern and trend over the time period tested. Now, an overview analysis can really only be done in a 3-centimeter section. If you do need to go back, say, for example, 6 months, we would analyze that as 2 3-centimeter sections. So you'd have a result for 2 3-month sections. One section for the first 3 months and then second section for the following 3 months. Whereas the month by month will break that down into 6 individual monthly sections and you'd have a result for each individual month. Okay. So what are the most commonly abused drugs? Well, the tests that we do can really be tailored to the drugs that you're actually looking for. So it can really be case specific. So we can really look just for the one drug, or we can look for the most commonly used or the most commonly tested drugs, which is this panel of 9 that are on the screen now. So that includes benzodiazepines, cannabis, cocaine, ecstasy, ketamine, methadone, methamphetamines, which includes amphetamine and opiates. So, I mean, you can select one of those drugs, all of those drugs, or even a drug which isn't listed on there. So the test that we can do can be case specific. we are doing some research to establish the most commonly detected drugs that we have at the laboratory. But at the moment, the two that we test for most frequently are cannabis and cocaine. Now, as I said, cannabis is one of the most frequently requested drugs that we have here at Lex Talks. And we often get asked about cannabis-based products that could impact on the hair drug testing for cannabis. So essentially, cannabis-based products generally contain CBD, which is a substance called cannabidiol. So this is a plant constituent found in the cannabis plant. Now, individuals who use legal CBD oil may have concerns about whether it would cause them to fail or give a positive result for cannabis in the hair drug test. Now, the drug test that we do at Lextox looks for cannabis, looks for delta 9 THC. So this is the parent compound of the cannabis plant. So it's the compound that gives people the effect of cannabis. But we also look for two metabolites of delta 9 THC. So this is 11-nor-9 carboxy delta 9 THC and 11-hydroxy delta 9 THC. So these compounds, these metabolites, are produced by the body when cannabis is ingested. So the presence of those two metabolites confirms cannabis ingestion. Now, commercially available CBD oils or other products that contain CBD, they contain the plant constituent, as I mentioned, cannabidiol. Now, these products, these CBD oil products, contain, if any, or very little delta 9 THC. And delta 9 THC is the controlled illegal compound. So therefore, the use of any CBD oil or legitimately bought CBD oil should not give rise to a positive delta 9 THC or any metabolites in the hair test. So therefore, the use of these products shouldn't give rise to a positive hair test result for the cannabis compounds that we look for at Lextox. However, at the time of the sample collection, we do ask that any products, whether prescribed or purchased, should be declared at the time of the sample collection, so then we can include that in our interpretation. So following on from that, we often get asked about the use of medication and if that could give rise to a positive drug test result. The test that we do at Lextox is very sensitive and specific. So if we see a drug such as cocaine, it can only be cocaine and it can't be anything else. So therefore, any medication wouldn't give rise to a false positive for a drug such as cocaine, because the test is very sensitive and specific, so we can actually distinguish between illegal drugs as well as away from the legal substances, medications. So, for example, with cocaine, we often get asked if benzocaine, which is often used as an oral pain relief, can give rise to a cocaine result. Benzocaine and cocaine are two different compounds. So if we see cocaine, it's only cocaine. Okay. But as I said on the previous slide when we was talking about the CBD oil products, it's really beneficial if the donor could provide the list of medications that they are taking, either purchased or prescribed. If they could provide them at the time of the sample collection, we can then include that in our interpretation in the actual expert report. We often get asked about requesting drug testing to cover a specific period. And the simple answer is yes, but there are a few considerations that you'll need to be aware of in order to get that specific time period. So it does take approximately 14 days from use of the drug for the hair to grow then sufficiently out of the scalp for it to be included in the analysis. So this means that it takes 14 days from ingestion of the drug for that drug to then be transported around the body, for the drug to be incorporated into the root of the hair, and then for the hair to grow sufficient length out of the scalp, which is then containing that drug, for it then to be actually detected and included in the analysis. So this is really important if you are looking for a particular time period, because we take 14 days off that sample collection date. So if you're looking to cover the whole of a month, then you would need to arrange the collection in the middle of the following month, because we take 14 days off that sample collection date to give the approximate time period. But if you do have any questions around that, your dedicated client manager is able to provide a guidance around the timeframes to ensure that the test that we provide is covering the period that you really need. We often get asked about exposure to a drug and if that could lead to a positive result. So we have a number of measures in place to prevent positive results from exposure. So the first is that we wash the hair prior to analysis. So we wash every section of hair prior to analysis. So this helps to remove any compounds, substances, or anything on the outside of the hair. So what we're actually analysing and detecting is from within the hair itself. The second is that we look for the presence of metabolites. So as I said when we were talking about the cannabis, we look for a number of metabolites. So these are produced by the body when the drug is ingested, broken down by the body. So the presence of these metabolites in hair helps to confirm actual ingestion or use of that particular drug. But we also employ reporting cutoff levels. So these levels are set to show the repeated use of that drug. So if we found a substance, a drug such as cannabis, delta-9 THC, at a level above the reporting cutoff, then that would really indicate use of that drug. So we do have these measures in place to prevent a positive result from exposure. However, exposure can't be completely ruled out, and in these instances what we'd expect to see is very, very low levels of the compound, and we wouldn't expect to see any of the metabolites. Now, for exposure to give rise to a positive result, that exposure would have to be on a regular and frequent basis, and the hair sample coming into actual contact with that drug. So it wouldn't be just walking past somebody at a bus stop who is smoking cannabis, for example, or one night at a party where cannabis is being used and cannabis smoke is in the atmosphere. It really is that regular and frequent exposure to the drug. But if you do have any questions around that, you can always come back to us and ask our experts at the lab. We can look at the levels and we can give you a response around that and say whether it's a plausible reason for the compounds detected at that level in the section of hair that we've analysed. Okay, can nail clippings be used if there is no scalp hair? Essentially, hair and nail is the same material made by the body. However, there's no independent society similar to the Society of Hair Testing that has agreed on a consensus for the nail clippings and therefore the interpretation of those results. So with hair testing, we do have the independent body, the Society of Hair Testing. So this is an international body of hair testing experts, of whom all of our Lex Talks experts are members of the Society of Hair Testing. And we agree on a consensus for drug and alcohol testing in hair, setting reporting cutoff levels and the interpretation of the levels that we see in a hair sample. So there isn't a similar society or internationally agreed consensus for nail testing. So if you do use nail testing, then I would recommend that you use it with caution. So whilst drugs can be detected in nails, because there's very little published scientific data, it's really not possible for us to provide an interpretation around what that level actually means. With hair samples, for example, we can report on the level and state whether we feel this is low, medium or high. With nail testing, we wouldn't be able to do that. We'd be able to state the level, but we wouldn't be able to interpret it. So for those reasons, it's not something that we're currently offering. We are doing research to develop that method, but we would always, at this moment in time, recommend hair testing over nail testing. In addition, it's very difficult to provide a time period with nail testing due to the way the nail grows. So it can grow from the base, but it can also grow from underneath and then fuses together to form the nail. So because of this growth cycle, it would be very difficult to provide a time period. And also, if you look at your own hand, your thumbnail, for example, is probably a lot bigger than the nail on your little finger. So it would take a longer period of time for the thumbnail to grow to the tip for it to be collected than it would for your little finger. So the time period would be really approximate. Okay. Okay, so moving on to alcohol testing. During the COVID-19 pandemic, many of us have been using hand sanitizers a lot more frequently than we were using them before. And many of these hand sanitizers do contain alcohol. Now, the use of hand sanitizers, even those that contain alcohol, would not give rise to a positive hair alcohol marker testing at Lextox. So essentially, the test that we do is for chronic excessive alcohol consumption. That's a hair test that we provide, and we look for two markers, ETG and ETPA. So ETG is produced by the liver when alcohol is ingested. ETPA is produced by the body in the presence of alcohol. So ETPA can be elevated in the hair through the use of products containing alcohol, such as hairspray, hair gel, but ETG wouldn't be affected by these products. So even if hand sanitizers were used on the hands, they wouldn't provide levels of ETG or ETPA in the hair at levels that would be at chronic excessive alcohol consumption. So similarly, the use of the hand sanitizers would not affect the blood tests. So if the hand sanitizers are used as per the manufacturer's guidelines, i.e. used on the hands, they wouldn't impact on the hair alcohol marker test or the blood alcohol test that we provide. Can hair products, bleaching and hair dye have an effect on the hair alcohol marker result? As I said in the previous slide, when we were talking about the hand sanitizers, products that contain alcohol can elevate the ETPA marker, but both markers, ETPA and ETG, are sensitive to the use of hair treatments such as bleach, hair dye. So they can actually reduce the levels of those markers that we would see in the hair. At the time of the sample collection, we do ask the donor to declare the use of any hair treatments, so then we can take that into consideration in our interpretation. but we also make our own observations of the hair sample upon receipt of the laboratory. So we look to see if there's any notable colour change along the length of the hair. If there is, then we would make a note of that and include that in the report and in the interpretation. During the analysis process, if we notice a colour change in the extraction solution, we would also make that observation in the report. So essentially, yes, bleaching the hair or hair dye can lower the levels of both of the markers in the hair, and they could lower them to below the reporting cutoff level. But we wouldn't be able to state by how much they could lower, because different people's hair can react to those treatments differently, and it also depends on the frequency of the treatment as well. Okay, so moving on to blood testing. What time period can blood alcohol testing cover? So the blood tests that we provide are really there to show the more recent use of alcohol. And again, it's chronic excessive alcohol use. The liver function test is a snapshot in time. So it's assessing liver damage at that moment of time that the sample was collected, because the liver can repair itself over time. So it really is just at that moment of time on the day of the sample collection. The CDT test, which is carbohydrate deficient transferring, and the PEth test, which is phosphatidylethanol, they're generally looking at the past 2 to 4 week periods. So they're really useful for assessing excessive alcohol consumption more recently than the hair. So if you can combine it with a hair test, the hair will go back historically over a number of months, typically 3 or 6 months, whereas the blood test will give you a result over the past 2 to 4 week period. And that's really the difference between the hair and the blood testing. So the hair is a longer period of time. The blood is more recent. Now, the hair and the blood tests, they are two different tests, and they're two independent tests looking for different biological markers. So you can actually get two different results. So it doesn't mean that one test is right and one test is wrong. It just means that they're looking for different markers, covering different periods of time. So therefore, they could have different results. So say, for example, the hair could be positive, indicating that over the past 3 months, there's evidence of chronic excessive alcohol use. But more recently, with the PEth test, for example, which is really only looking up to the past 4 weeks, that could be negative. So it could indicate that more recently, they've reduced their alcohol intake and it's not at a level which could be chronic excessive. The blood tests aren't affected by any hair treatments or hair products in the same way, in the way that hair alcohol testing can be affected. So the blood test wouldn't be affected by hair products or hair treatments. So they're really good tests to have in corroboration to help provide an overall picture of somebody's excessive alcohol consumption. Can body hair be used for alcohol testing if no head hair is present? Yes, essentially. If no scalp hair is available, then we can collect and analyze hair from the chest, leg, or the arm areas for the hair alcohol test. We wouldn't be able to analyze hair from the underarm, pubic or beard, or other body types, and that's due to potential contamination from urine in terms of pubic hair, or increase in levels due to sweat, for example, in the underarm area. So for that reason, we would only analyze chest, leg, or forearm hair in terms of the hair alcohol test. And we analyze that as an overview analysis. Okay, and give an approximate time period on that. Which leads us nicely into why we can't segment body hair, and the reasons why we can segment scalp hair, for example, and give that month-by-month analysis. So the reason why we can't segment body hair for the month-by-month analysis is that body hair has a different growth cycle to that of scalp hair. So whilst it might grow for the same average growth rate of about 1 centimetre a month, although that does vary depending on the site of the body hair, body hair has a different growth cycle. So it means that a greater proportion of the body hair is in its resting or non-growing phase. So with body hair, on average, about 50% is not growing, what's called in its resting phase, and about 50% is growing. So we have to take the proportion in the non-growing phase into consideration when establishing a time period. Now, in comparison to scalp hair, 85% is actively growing, so that's picking up recent drug use, whereas only 15% is in this resting or non-growing phase, which is why we can give it a more time-resolved analysis and break it down into a month-by-month. Whereas with body hair, because a greater proportion isn't actively growing, is in this resting phase, we can't provide that time-resolved analysis in the same way we can with scalp hair. So as I said, we take the resting phase hair into consideration and establish a time period, and then we also take into account its growth rate when we calculate the time period and the length of the hair received. So we really wouldn't be able to provide a time period to the body hair sample until we've actually received the body hair into the lab. We've measured it, we've measured the length, we apply the growth rate, take into consideration the non-growing phase, and then we'll provide that approximate time period in the expert report. Typically, a body hair sample can cover between 4 and 18 months. So it does depend on where the body hair has been collected and the length of the body hair as well. Okay. In some cases, with body hair, the individual has shaved an area of the body. So, for example, shaved their underarm hair and then allowed that hair to grow. And then we've collected it in 4 months' time. So then that's we can then be confident that that body hair, if it's grown in that 4-month period, would only be covering that period of 4 months. Now, in those instances, we would need written confirmation from you of the date that the actual body hair area was shaved, so that we know that we're not using any hair prior to that area being shaved. So that we can provide a time-resolved analysis with body hair prior if the body hair in that particular area has been shaved and we're collecting it from that shaved area and the date of shaving has been confirmed by yourselves. But please feel free to ask us for any kind of guidance around that. Okay, so that's draws us to the end of some of the frequently asked questions that we get asked as experts at Lex Talks. If you do have any questions, you can visit our website for a detailed list of frequently asked questions. You can contact your dedicated client manager, who will be able to discuss any testing options with you in order to understand the best option for your case, and we can really be case specific in the testing that we provide. Our expert reports interpret and explain the test results clearly and succinctly to help you make those the decisions that you need. However, if you do have any queries on the results upon receiving the expert report, our team of experts can answer those for you. So you can put questions in writing to experts@lextalks.co.uk, ideally quoting the laboratory sample number beginning with LX. Alternatively, you can give us a call and then we can arrange for myself to give you a call back or one of our other experts. And you can also email experts with any questions you'd like me to answer specifically around today's session. Okay, so then just to summarize, The use of CBD oil would not give rise to a positive result for delta-9 THC or cannabis metabolites in hair. The use of hand sanitizers would not give results to positive hair alcohol markers or the blood alcohol tests that we provide at Lex Talks. It takes approximately 2 weeks from the ingestion of a drug for it to be detected and included in a hair sample. So we take 2 weeks off the sample collection date to provide that approximate time period. When we analyze hair samples, we analyze them for their metabolites. So the metabolite helps us to confirm usage of a drug. If no scalp hair is available, then we can analyze hair from the chest, leg, or arm for the hair alcohol marker testing. And it's recommended that the donor declares the use of any hair products, bleach, or dye, as well as any medication at the time of the sample collection, so that we can take that into consideration in our interpretation of the analysis results. I'd like to thank you for your time today. Thank you for listening to today's session. As I said, if you do have any questions, please feel free to contact us. Contact details are on the screen, which are experts at lextox.co.uk, or you can call us on 02920 484141. I'm Liam Feasey. I talked you through today's session, so please do get in touch if you have any further questions. Thank you ever so much. Thank you.